name is Edward Lin. I'm a family medicine doc here in Portland. Alex and I, we had this idea and we put together this wall, this personal protective wall, because in my clinic, I'm seeing patients, and the situation is that we don't have enough, as a whole country, we don't have enough PPEs, but yet we're still called upon to take care of the patients the best we can. So to maximize protection for all the clinicians, and also to save on PPE for the really high-risk scenarios, we put this wall together. The idea of this wall is that it can really provide excellent droplet transmission protection, and also partial aerosol transmission protection with an additional ventilation system that's going to be put in later on. Right now, we built this for use inside a examination of patients, of sick patients, outside in a tent scenario, where the patient can come in through this one entrance, be on the other side of the wall, and then I come in through the second entrance on the other side and be able to provide a pretty good examination with vitals and everything, with obviously this protection here. Okay, this can also be modified to be used for like a drive-through, or I guess walk-through COVID-19 swab testing. It can also be used. It can be made smaller and modified for blood draws. So there's all sorts of scenarios. It could also be used inpatient, one box for each hospital room per patient, so that nurses and doctors can use the same unit, examine the patient, come back out without having to go through PPE for all the routine daily work. So if we come in closer, I can show you all the features of it. So first off, this is the stethoscope that we extended it out. It goes straight through the wall. It can fit up to a range of heights. It works pretty well. You can use any stethoscope you want, really. So it goes from here, all the way extends out to here. So there's good flexibility there. These gloves, obviously you put your arms through it, and it comes up to your shoulders, so you can really have a wide range of movement here. Looking past the glass on the other side, you can use a simple pulse oximeter, thermometer, and a automated blood pressure cuff. You can help the patient use it, or if the patient's able to, they can just grab it themselves, and you can see what the vitals are. Okay, so let me just put my arms in and show you, demonstrate it. So I can auscultate the lungs from sitting, front and back here, sitting position, and also in a standing position as well. So putting this down, we can also easily do a COVID-19 swab, just like this, nose or nasopharyngeal or oropharyngeal. I can palpate the abdomen, and that's, I think, going to be very helpful. Okay.